Welcome, everybody. My name is Amy Pepiora, and I'm the program coordinator of the Refugee and Immigrant Core of the Trauma Community Resilience Center out of Boston Children's Hospital. Thank you for all of you who have been able to join us today for what is the fourth session of our 9-part series, Best Practices for Working with Refugee and Immigrant Youth. We'll be hearing today about the 4 Core Stressors Toolkit. As you may know from attending our previous trainings, this session is part of a 9-part series offered by the staff and faculty of the Trauma and Community Resilience Center at Boston Children's Hospital and Harvard Medical School. We're able to present this series because of support from SAMHSA as a part of the National Child Traumatic Stress Network. Some quick housekeeping for today. Closed captioning is enabled for today's session. Our session is being recorded, and the recording will be available after our session. While we do ask that you keep yourselves muted throughout today's training, please utilize the chat for all comments and questions, which we really encourage. Our plan is to leave some time for Q&A after we hear from our presenters. Already by registering today, you'll be receiving information for our upcoming sessions, including our next session on Monday, May 23rd at noon Eastern for a presentation on secondary traumatic stress. If you've missed any of our previous sessions, we'll be populating the link to all of our recordings in the chat this morning or this afternoon. In the coming days after today's session, you'll be receiving an email with a copy of the slides, a link to the recording, and if you're a social worker or psychologist, a post survey to complete for CEUs. Please, again, I'll say, feel free to utilize the chat to ask any questions at any time. We are expecting a very large group of participants across the US and beyond today, so we hope to hear your voices throughout. Before I hand it over to our presenters, I would like to start with a land acknowledgement, which reminds us all that colonization is an enduring reality and recognizes the traditional lands on which we live, work, and study. We are here in Massachusetts, and we recognize that this land was home to the Mashpee Wampanoag, Aquinnah Wampanoag, Mimpuk, and Massachusetts tribal nations. We also acknowledge the legacy of slavery in our region and the enslaved African peoples whose labor was exploited for generations to help establish the economy of our region and the United States. We ask you to join us in acknowledging these communities, their elders, both past and present, as well as future generations, and acknowledge that Massachusetts was founded upon exclusion and erasures of many indigenous and African peoples. I'm now going to turn it over to my colleague, Dr. Luna Mulder, to introduce herself and start us off with our presentation this morning.
Thank you, Amy. So I am Luna Acharya Mulder, and I am a psychologist at Boston Children's Hospital Trauma and Community Resilience Center, and I will be one of the presenters today. I'll pass it over to Jeff.
Hi, everyone, and thanks, Luna, and thanks, Amy. I'm Dr. Jeff Winter. I'm a clinical psychologist and researcher at the Trauma and Community Resilience Center at Boston Children's. And it's really an honor to get to present this presentation today with my close colleague, Luna. And I'm really excited that everyone is here today, and welcome everyone. And today is meaningful to me because it's a toolkit and a framework that has a lot of meaningful practice and research behind it, and is hopefully an applied tool that you can put into practice later today in a session you have this afternoon. So today we'll be presenting a presentation called 4 Core Stressors Toolkit, or the 4 Core Stressors Toolkit. And again, as Amy mentioned, this is part of our best practices for working with refugee and immigrant youth for mental health practitioners. So the learning objectives today, as Luna and I will be moving through the slides, is we're going to introduce folks to the refugee and immigrant 4 Core Stressors framework. We're then going to introduce folks to the refugee and immigrant Core Stressors Toolkit, which is an online web tool that's freely available that we'll spend the second half of today talking through about how to put it into use with clients and families that you're working with. And then in that, we'll demonstrate the use of the Core Stressors framework and toolkit through demonstration with a composite clinical example. So again, really taking this sort of academic framework and putting it into real life. And the reason why it's important to put it into real life is because, as you likely know or have learned from colleagues, psychosocial assessment in mental health practice in general is complicated. with families of refugee and immigrant backgrounds, it is particularly complex. And that complexity is through no fault of the kids and families we have the honor of working with. It's because of the layers of complexity that are the result of enduring a forced migration legacy and the levers and the processes that can influence both the resilience and the barriers to care that everyone on this call hopefully is very eager in trying to work through. And so this is not a photo of me, but it's a similar photo of my first couple of sessions working in a refugee and immigrant mental health program when I was in graduate school. And if you were to take like a MRI or an X-ray of my brain as I left that first session, I had a lot of thoughts going on in my mind. And I imagine other people may have had this experience. So in those first assessment sessions, if you have, again, the privilege of working directly with folks of refugee immigrant backgrounds, there are a lot of pieces at play. And if you were like me, I went into that eager, excited with some assessment experience, and I felt intensely underprepared. I was asking questions and felt that the questions I was asking were kind of appropriate, maybe not as effective. I was working with an interpreter the first session I'm thinking of, but there was a lot going on. So again, here, some of the questions that may come up in an early assessment session. Questions around isolation, questions around healthcare access, questions around housing stability, questions around employment status, legal status, immigration status, family resilience, education, anti-immigrant bias. I mean, the list goes on and on and on. Luna and I put this together. It took us about 2 minutes to put this slide together of just common things that come up in assessment. And so what our group at Boston Children's Hospital has worked on for more than a decade is trying to take all of this complexity that is inherent in assessment and trying to organize it in a way that practitioners who are doing direct service are able to triage this material, so that way it makes your job more effective, it makes your job less stressful, and it increases the likelihood that the kids and families that we're trying to help actually can engage in the services that we believe may be helpful. And so all of that content that you saw in that previous slide can be organized into one of these 4 categories. And we refer to this as the 4 core stressors. Sometimes it's called 4 common stressors experienced by refugee and immigrant kids and families. And so we're going to be going back to this visual and these 4 tools again and again today. And if you have the opportunity to work with our group in different capacities, you'll hear these 4 terms mentioned a lot. Now, these are not terms that our group specifically developed. What we've done is try to take these categories that are very common and organize it and then put it into tools that folks can put into practice. So these 4 categories we'll be talking about today are in the bottom right corner, we'll talk about resettlement stress. In the upper right corner, that orange, we'll talk about something called acculturative stress or acculturation stress. In the bottom left corner, the green, call it isolation or isolation stress. And in the top left corner is traumatic stress in the blue. And this is an academic framework, and we'll provide a little backing of the evidence for this toolkit. However, this is something, again, this is an applied public health tool that you can start using tomorrow. And so if you go actually to our website or use this link, if you type that link into your web browser, you'll go to our front page, you'll find a photo, and sort of diagonally above Luna and my heads, you'll see this blue button that you can click on, and that will bring you to this online toolkit. And we're gonna, again, spend some time later today going through the toolkit, talking about what it is, and then I'll share my screen and show you the toolkit. So there's lots of online toolkits. I mean, there's more than 10,000 mental health focused apps in the App Store right now, many of them totally underused. So you're saying, okay, another thing online, what's the point of this? Here is some of the point of this. So how can this toolkit help me in my work? Jeff, give me the sell. Where is the value add for using this later today? So this can be used with any resettled refugee, immigrant, asylum seeker. It provides questions that guide a needs assessment of stressors after initial resettlement. So resettlement in the country or context where folks may maintain for a period of time. It's a framework to organize information. Again, organizing all of that cluster and then triaging services. Is not going to give you the nitty gritty of psychotherapy techniques. It's going to set you up. It's that first leg of the race. Imagine a 4x100 relay in the Olympics. It's the first part of that race. Where do I go? Got the baton, go into my next thing. We're trying to set you up to do the next part of your work. after the assessment that you can conduct, the provider, you're rating the client's needs on low, moderate, and high. And again, we're going to work through this together today with our composite example. And then based on the level of risk, it provides recommendations for interventions. And then the interventions are focused on resources and services that can help. So how to access basic needs or improve basic need access, identifying community supports, referring for further mental services. Again, that first leg of the intervention journey. And now we're really fortunate that we've been able to demonstrate that folks like using this toolkit, and there is some amount of evidence supporting it. So these are two academic papers. One is on the left that was led by our colleague Seetha Davis, who's now an MD PhD student at Harvard Medical School. And this was really a tool, a descriptive paper, basically trying to understand, do people use the tool? How do they use it? Where in the world do people use the tool? And I'll talk a little bit about some of the data that Seetha found in her paper that she led. And then on the right of your screen is a paper led by Dr. Jackie Brady, who is a school nursing PhD. And she had worked in schools before working on this paper for more than 2 decades. And so this is a clinical paper talking about direct service example of using this toolkit in a school nursing setting. Again, school nurses, for example, are amazingly positioned to be an incredible asset for refugee and immigrant families. And so we can provide those two papers. They're available online if you search for them, and we can also send them if you need them, if you're curious. So then from Seetha's paper, we learned, and actually this number is updated from that paper, since it was put online a couple of years ago, this tool has been accessed more than 4,000 times by folks around the globe. So not just by individuals who are working in the United States, although that's where the primary use domain is. And again, folks across the United States, lots of different areas. So that was really exciting for us to learn. And we also learned in the paper that Seetha Davis led that there are 2 primary tools or primary reasons that folks are using this toolkit. The first one, and this is how I actually first came to the toolkit as a provider, was for personal educational use. So this is an example of a quote, someone saying, I use this toolkit to help inform me about the many stress factors for immigrant communities and ways to intervene to help. So when I was working in the mental health program that I was working at 2014 to 2016, I found this toolkit or version of this toolkit, like an early version online. And I literally said out loud, oh my, I wish I had this 2 years ago, and then went on and tried to convince other people in my program to utilize it. So I feel very lucky to now be on this side of the project. The other piece is for folks using it for individual psychosocial assessment use, which is actually how we're going to really focus on it today, using a specific case and then walking through the 4 components. And so the person who used this said, this is a great tool that I will use to assist in providing care to clients. One thing you can imagine in sort of a natural life cycle of using this tool is if you use it with a specific client, for example, the second category, and then over time, you use it to inform your general assessment practice. So one thing that we recommend for providers is print out that 4-core stressor image that we have, stick it up next to your desk or put it in a folder that you have access to, because once you get more comfortable thinking in this way, there'll be lots of amazing clinical flexibility and wisdom that you can apply to it. The tool does not replace your clinical judgment, your supervisors, a thoughtful, culture responsive intervention, and it's intended as a sort of a supplement, as a framework to help you, do the great work that you're doing. So this is the core stressor visual with the 4 core stressors and then some of the components that sort of blossom out from it. And we're going to walk through each of these categories today. Again, explaining it at sort of a high level and then anchoring it to a specific case. And with that, I'm going to turn it over to my colleague, Luna.
Thank you. All right, so we're going to walk through this toolkit and how it works using a case example of Raju. Raju is an 11-year-old Bhutanese boy who came to Massachusetts from refugee camps in Nepal as a refugee a year ago. He lives with his mother, father, grandfather, older brother, and younger sister. Raju's grandmother, who helped raise him, died soon before the family left Nepal. His mother and father primarily speak Nepali, and the children now speak both English and Nepali. Raju's teacher reports that he is aggressive and oppositional in class, and that he is not progressing academically. he is referred to you at a local mental health agency, and you will work closely with Bikash, who is a Nepali-speaking interpreter and cultural broker, to conduct a needs assessment using the Core Stressors Toolkit. So, next slide, please. As mental health providers, we may already be starting to hypothesize, what could be influencing Raju's behaviors. Even with just a very little bit of information that we have, we know that he came from a refugee camp. We know that his grandmother died. So let's take this incident that took place in his classroom, right? We don't really know anything about what happened right before, but what happened was that he threw a book at another student and ran out of the classroom. So that's the incident. So taking that incident, we could have a million different reasons for trying to hypothesize what could be going on for this child. So we've got right here at the if you look at all the arrows coming out from the bubble in the middle there, we've got resettlement stress, acculturative stress, traumatic stress, and isolation stress. Those are the 4 that we're going to talk about in depth. There could be a lot of other things going on as well. So disrupted education, peer-related concerns within the classroom or within the school, maybe the loss of his grandmother, and lots of other reasons as well. So why did we do this? We won't know, of course, until we do a much more thorough assessment and ask the right questions. But his behaviors could be the result of stressors across multiple core stressor domains. So clarifying what is driving certain behaviors will increase the likelihood that the interventions that we come up with will be helpful. So we are going to meet with mom. Mom came alone for the assessment. So it's a mental health provider. We're going to, of course, be working closely with an interpreter. Mom's primary language we know is Nepali, so best practice when working with an interpreter, you're meeting with that interpreter prior to this appointment with mom to talk through the purpose, goals, and the agenda for the meeting, right? So this includes thinking through how key terms will be interpreted into Nepali. This is really, really key because so many words that we use in English, especially in the mental health field, they do not translate very well into other languages. So we really want to make sure that we're meeting prior to the appointment, every session, and talking through what is the purpose, and then giving time for the interpreter to think through, how would I frame this? How would I say this so that it makes sense and is understandable for the client that we're working with. So, and this is a sample script for kind of framing the purpose of this assessment, and any assessment really that you're doing with the refugee or immigrant family. Saying something like, I will ask you some questions because I want to understand how we can support Raju's success in school. I will ask questions about what you and your family need right now, what you and your family have been through, and what has been difficult since resettling in the US. I know this can be hard, so if there's anything I'm asking that you do not want to answer, please let me know. The more we can learn about you and your family, the more we will be able to understand why Raju may be struggling in school and how we can help. The goal of these questions is for us to then have a plan for how we can support you. So very simple language, focusing on school success and being clear. We're going to be asking a lot of questions. Why? People get asked so many questions all the time, and it's unclear what happened, after that, after revealing all this personal information about themselves. So being very clear, we need to have this information so that then we can have a plan forward, a path forward for how we can be helpful. And then in terms of the order of the assessment, we recommend that asking about resettlement stressors comes first, and we'll talk about what that means exactly, but it's really questions around basic needs. That comes first. And then we have acculturation stressors, isolation stressors, and then we ask about trauma and traumatic stress at the end. So, okay, we're starting with resettlement stressors. That's the bottom right corner of the spiderweb branch that we've been showing. And that again includes things like basic needs, legal status, and healthcare and access to services. So resettlement stressors is all about financial stress and whether or not a family is able to pay for basic needs. So food, healthcare, access to transportation, stable housing, stable and safe housing, jobs, parental unemployment or underemployment. And then we know that legal status greatly determines whether or not families have access to certain public benefits. So for this particular family, right, they came here as a refugee, which means that because they have that refugee status, they automatically receive federal benefits and public benefits like housing and cash assistance and food assistance and healthcare and things like that, but only lasts for 3 months. We know that this particular family they've already been here for a year. So how are they paying for their basic needs now that that 3-month time has run out? Will be really important to ask about and seeing if we can provide support in that way. So what we're going to do now is Jeff and I are going to do a little role play to demonstrate how to ask the questions and then what we do with the responses. So these are the questions to guide the assessment of resettlement stress. Normally, we would, of course, like I said, have Bikash, the interpreter, cultural broker, with us. Between the three of us, Jeff will be the clinician. I'll play the mom, Raju's mom. We would have Bikash with us. We do not have another person that speaks Nepali on our team, so it'll be just the two of us for today. But just imagine, though, that all of this is happening with 3 people, and kind of a triangle interpretation, which is a whole other training that we will do in a few months on working with interpreters and culture brokers. But for the purposes of this particular training, we're going to just go through the questions, go through the responses, and then decide how we would rate the level of risk, and then the interventions that we would use. So pay attention to what mom is saying, because then you guys are going to be involved in a poll deciding kind of where we would rate the family.
Great, thanks, Luna.
Yeah.
So again, folks, pay close attention to particularly the questions I'm asking, and more importantly, the way that Luna is responding to that, because then, as Luna is saying, we're going to be asking you to be thinking through how you would assess that. So again, imagine that you're sort of in the clinician seat with me, you're hanging out with me over here, and we're asking and then trying to understand how we're organizing it. All right. So does your family have a caseworker through a resettlement agency?
Yes, we had a caseworker when we first came. He picked us up from the airport and took us to our apartment. We no longer are getting the money or have an EBT card anymore.
Do you have everything you need now? For example, food, a safe place to live, clothing, medication, and are you able to pay for everything you need?
We came to the US from the camp in Nepal, and at first they gave us an apartment, some money, and an EBT card, but we are not getting that money from them anymore. We paid them back for our flights. We just received the money for caring for my father-in-law. My husband does this. I work to pay rent and for food. Money is sometimes not enough if the kids want to do something that costs money, like seeing a movie or shopping. So my husband really needs to find work. My father-in-law lives with us. My husband gets money to look after him. We thought they would have a job for us when we first came, but we had to find jobs ourselves.
Do you and all members of your family have health insurance and a doctor?
Yes, we have Medicaid, MassHealth.
And are you able to access transportation in your neighborhood to get to work and appointments?
My husband is learning how to drive now from our neighbor. I take the bus to work and learned how to do that. The kids can walk to school. It's close.
Are you or anyone in your family involved in immigration proceedings? For example, actively seeking a green card or seeking US citizenship?
We know another Bhutanese family who's working on getting their green card. They've been here much longer. We're applying for a green card now or soon.
Do you have a work permit? Are you and your husband both employed?
Yes, I work now at the meat factory and I'm able to pay rent. My husband cannot find work though, and we are really having a hard time with this. He wants to work because he's the man, but he cannot find anything. My father-in-law is disabled and my husband looks after him, but he's also looking for nighttime work for extra money. Okay, so after that, so now what I'm going to do is go through the 3 different levels of risk. And then we're going to kind of talk through where we would place this family based on the information that we have. So low, if we would rate the family low would be that the family is coping well with resettlement stress, and they may be experiencing occasional stressors related to finances, housing, and community stressors. However, they are able to access appropriate resources and seek support from the community when needed. Moderate would be that the family is experiencing 1 or more areas of resettlement stress, such as trouble paying their bills, difficulty finding work, housing problems, community violence, transportation problems, difficulty accessing medical or mental health resources, and limited community support. And these stressors are impacting the family or child's functioning and resulting in a distressed living environment. And then high is that the family is experiencing high levels of resettlement stress that are interfering with the family's functioning and posing a safety risk for family members. So we're always thinking about safety when we're at the high level. So things like homelessness, eviction, lack of food, inability to access medical services. And these stressors are impacting family or child's functioning and resulting in a threatening environment at home or in the community. So in terms of this particular family, right? So we know that this is a family of 6, 3 children. There's a mother, there's a father, and there's a grandfather. And we know that the mom works so that there is some income coming in. We know that the dad is hoping to find work. He's looking. He is getting income from taking care of his father-in-law, a disability, caretaking check that he gets. And we know that they do have stable housing. They're able to pay for basic living expenses. They do have health insurance, and they are able to access transportation. The mom takes a bus to work. So all of those things are in place. So knowing this, right, we're going to do a quick poll. What would you rate this family's level of resettlement stress? Low, moderate, or high, based on the information that we have so far?
Lots of results are coming in, Luna and Jeff, so I'm going to wait until
Excellent.
we hit sort of a mass number.
Sounds good.
Okay, I'm going to end the poll and see where we're at.
Awesome. All right. It looks like 80% of the people said moderate risk. That's excellent. If you click the next button, yep, we would agree. We would also place this family in moderate, just because it does seem like they have housing. There is some income coming in, but dad is actively looking for work as well. So maybe meeting all of their basic needs is a struggle. So there are some financial difficulties there that mom mentioned. So we'll put the family under moderate for right now, based on the information that we have. And then if you click the next, so these are the interventions that would go under moderate. We also have low there as well, because low would also be appropriate. But under moderate interventions are all around connecting with resources to help with basic needs. So for this particular family, what we would want to maybe think about is, so we know that they came here and they were connected to their local resettlement agency and a caseworker through that, which is typically how refugees come through the US. They go through the resettlement agency, and a lot of their basic needs and case management services are through that. So if there's a way to reconnect with that previous worker or another worker, or maybe through a case manager through your mental health agency, we would need to consider doing that, think about doing that to see if the family might be eligible for public benefits, given the income that mom is bringing in, as well as the disability income. They do qualify for Medicaid, so they may qualify for other public benefits as well. So if we can support in that way, we would. And then certainly also helping with employment services for the father who really wants additional work, or additional income, I should say. Right now, he's the primary caretaker in the home. So that would be kind of the interventions that we would want to be thinking about for this family. And then acculturation stress. So this is the next set of questions that we want to ask to learn more about acculturative stressors. So this is the top right-hand corner of acculturative stress. Acculturation, parenting capacity, and language. So common acculturation stressors for refugee and immigrant youth and families, of course, learning how to speak English, right? I would say one of probably the biggest challenge for a lot of people, navigating a new culture, learning how to live in a very different, strange and new land where everything is different, and changes in family roles and responsibilities. So we already know with this particular family that there's some tension and stress with the mom being the primary breadwinner and dad having to be the primary caregiver. So that's been a huge shift, which isn't typical for Bhutanese families. Usually it's the male figure who kind of is the main provider. And so that's creating some tension and stress. Acculturation gap within families is also very common, where you have children acculturating at a much quicker pace than the older generation, picking up English and navigating cultural differences much more quickly. But what can happen though is that it really leads to a breakdown in communication between parents and their children, and we'll see how that plays out with this particular family. But it can be really stressful because in Bhutanese family, and I think a lot of other families, the older you are, typically the more respect that you have, and the more power that you have usually within your family. But after resettlement, because it takes longer for the older generation to pick things up, they feel really disempowered over time, and that the children end up taking the lead in what really a lot of things that probably isn't appropriate for children to be taking the lead on. And so a lot of stressors there. And then educational challenges for children. If they didn't have the opportunity to attend school consistently or at all prior to coming to the US. And then of course, just having to learn all academic subjects in English. And a million different reasons for why there are so many educational challenges for our kids. And then a lot of the assessments that we do in schools, learning assessments, also aren't normed for children, for refugee and immigrant children that were born and raised someplace else. And so a lot of the scores there aren't valid. And so it creates a lot of challenges for these kids as well. And then parenting in a new context. So for caregivers who are used to certain disciplinary strategies that they utilize may not apply or may not be allowed legally here. And so, or it just doesn't work here. And so having to learn how to parent in a new context can be really stressful. And then professional status as well. So many people who maybe receive degrees overseas, it doesn't translate here in the US. And so having to start all over professionally can be a tremendous loss and a huge stressor as well. All right, so Jeff and I are going to do another quick role play. Same thing again, same setup. You'll be the clinician and I'll be mom, and no interpreter again, but imagine that there is one, a third party interpreting.
All right. What do you think about US culture? What is different about US or the US compared to Bhutan or Nepal? For example, how are the schools different, or the food, or the people?
Everything is so different. We miss it back home in Bhutan and even Nepal, but it's safer here. School's better. We miss the food there. We don't understand most of the things in the grocery store.
How are you adjusting to the change in language and culture in the US? For example, have you taken an ELL class?
It's so hard not knowing how to speak English well. That's my biggest struggle. I feel uncomfortable going anywhere new where I know it will be mostly English-speaking people. I used to take ELL, but stopped because of work.
Do you always have someone to help you translate important documents and or to interpret at appointments?
Not always, no. Like if someone calls, I'm nervous answering the phone. I have my kids answer. At school in the beginning, they did not always have an interpreter, but that's better now.
Do you know how to contact your child's teachers?
They sometimes email, and my reading in English is not so good, but they are calling more now with an interpreter.
Did Raju attend school before coming to US? And if so, until what grade? And how was he as a student?
Yes, he went to school in the camp in Nepal. He went up to grade 3. He did okay. Not the best marks, but he was learning. He failed 2 times. He did not get into fights, though he was not doing bad things like he is now.
How do members of your family communicate with one another? Are there frequent fights or conflicts between family members?
Raju does not listen anymore. He's becoming too American. He listened to me back at home. At times we get angry and yell. We're always trying to tell Raju to behave. My husband and I are fighting a lot too, because he wants to work and does not think I should work.
Does anyone use physical force during arguments?
We used to hit the kids, but we were told not to do that anymore, so we don't know what to do now. Okay, so in terms of level of risk, right, based on that information, low would be that the child and parents may experience occasional conflict or acculturation related stress. So some internal conflict around cultural and language differences between the culture of origin and the culture of the resettlement country. But overall, the family is functioning well, communicating well with each other, and acculturation stressors do not interfere with the child's functioning at home, school, or in the social situation. So that would be low. Moderate would be that the child and the family report presence of some acculturation stressors, like parents feeling that the child is too American, frequent verbal conflicts, lack of communication, demonstration of cognitive disabilities or concerns that may hinder language learning, and child's difficulty negotiating new culture and culture of origin. And these stressors seem to interfere with the child's functioning at home, school, or in a social relationship. And then high would be child and family report high levels of acculturation stressors, including risky behavior. So it's again always around safety when we're at high. The child, parents, or guardians are using physical force during conflicts. Child's refusing to stay with the parents, and child is taking on too many responsibilities, like being the translator, the caretaker role, or the wage earner. And stressors are severely interfering with child's ability to learn the language and his or her functioning at home, school, or in a social situation. All right, so the situation with this particular family, we know that there is conflict in the home due to parents feeling that Raju has become too American. They're really struggling with parenting and disciplinary strategies, as well as difficulties with communication. The roles also have changed because the mom is, again, the provider, which has been stressful for the family. And then the caregivers are really struggling with the language barrier and not always having an interpreter for meetings. So knowing what we know, what would you rate? We're going to do another poll. What would you rate this family's level of acculturative stress?
Lots of people coming in. I love it. All right, we're at 65% of people have voted in. Let's try and get it up to 80.
Sounds good.
Okay. All right, I'm going to close the poll and share the results.
Awesome. We got 75% at moderate risk. So most people got it correct. We would agree with you that we would place this family under moderate level of risk in terms of acculturative stress. So in terms of what that means for interventions, next slide. Moderate interventions are all around helping families reconnect. So really directly addressing that acculturation gap, as well as counseling or mental health services to help with parenting in a new context. And then we would also want to be thinking about ESL classes or ELL, I should say, ELL classes for the caregivers. So for this particular family, the counseling services with Raju and his family would really focus on parenting in a new context. So teaching alternatives to corporal punishment and framing it as, that of course you know how to parent, but certain things that worked back at home may not work here, so we would need to adjust some things. And really the counseling, the home-based work or the office-based work with the family would really be around improving communication between family members. So things like, how would they talk to each other, understand each other's experiences, where is everybody in terms of their acculturative process, things like that. And then we would want to think about referring the mom and the dad to an ELL class because the language barrier is so intense, and it's really a huge source of pain for it sounds like for the mom in particular. And so a class that fits with her work schedule would be ideal. And then again, reminding them that when they're at these appointments at school, that the school is required to have an interpreter at these meetings, at these appointments, and that if they're calling home, they need to have an interpreter there. That's what the school is supposed to do. So if that is not happening, then that reminds them that is something that they can ask for and that they need to have. so that these meetings should not be happening in schools where they're there and nobody speaks their language. So those are the interventions under acculturation. I'll pass it over to Jeff to talk about isolation.
Wonderful. Thanks so much, Luna. And thanks everyone for your great participation on the polls. We really appreciate that. So now we're moving to the third core stressor domain, which is isolation or isolation stressors. And this is really referring to experiences of loneliness. And as folks are acutely aware, this has been enormously amplified during the COVID-19 pandemic. In the process of resettlement, folks may be resettled in contexts where there are not many families who are of a similar ethnocultural background, or they may be in places where, based on how the housing infrastructure of a community is set up, it may be harder to connect. So a common experience are lack of social support from folks that they live with in their community, or if they were living in a refugee camp, or even if they're in a place where there are other folks in their community, difficulties, this is sort of a resettlement stress coming in with transportation or finding ways to connect. There's also experiences of discrimination, both overt and covert, as well as the painful structural bias, oppression, and really systematic disenfranchisement of a lot of families of refugee and immigrant backgrounds. And that's woven through our systems. And so if you work in refugee and immigrant mental health, one sort of amazing opportunity is to work as an advocate for trying to identify these things that really thwart belongingness through, again, direct messaging and indirect messaging. And then how do you help families navigate that? You know, there's this painful truth. It's called the immigrant paradox, or the immigrant resettlement paradox, which is that at times mental health challenges for resettled communities actually increase over the course of years in resettlement. And one of the hypotheses about why that happens is that sort of the unearthing of some of the bias and isolation stressors that reveal themselves. So folks may have grown up in a context where there isn't the legacy of, for example, racism that exists in the United States. And then folks' identities evolve as they move into a new context based on how their, for example, their skin tone or hair texture is perceived in a new context. And so again, as we can understand some of these pieces, it gives us opportunities to surface them, to validate them, and then to advocate around them for families. Again, surfacing, acknowledging that they may be there, validate, meaning families are justified in having big feelings about them, and then advocate around how we can be helpful. And so these are some questions that we're going to walk through. Again, I'll be the clinician in this context. Luna will play the mom, and we'll just walk through some of the examples of isolation stressors that you may be asking, and then we'll walk through the toolkit. And one other comment I wanted to make, folks may notice in some of the questions we've gone through, we use what's called a double barrel or triple barrel question, where we're asking multiple questions. That's partially just because we're trying to teach a fair amount of content in a short period of time. When you're doing these assessments, it's never a problem to ask one question and then pause and then see if you have a response. Sometimes you may need to ask others, but you'll see that sometimes there are a couple of stacked questions. So do you have any friends or family nearby who are supportive to you? Does Raju have friends at school or in the neighborhood?
Yes, we have some family and friends, but we don't talk about these things. People don't really talk about problems with each other like that. I worry about people knowing my business. I don't think he has friends in school. I think some kids are very rude and tease him a lot.
Are you or Raju involved with peer, social, or sort of interest groups outside of school or outside of your work? For example, like sports teams or in a religious community or other kinds of social clubs?
No.
And have you been treated badly by people because of how you look or where they believe you're from? For example, when you've interacted with neighbors, or when you've been in a store, or when you've interacted with a public safety professional?
Yes, some of the time. I was at the grocery store with my older son and someone started talking to me. I didn't understand. My son told me, they said, "Learn English, you are in America." Some kids at school are treating Raju badly.
And so here is the level of risk framework for isolation stressors. So at low levels of isolation stress, child may experience occasional feelings of loneliness or isolation, and then overall the child is making friends, building friendships, and has sufficient social support from both adults and peers. And again, we think of this both as informal social support and potentially formal social support. So informal as in like there's not a professional infrastructure around that. Formal would be like working with a mental health provider or a social service professional or a peer mentor or coach. And then these feelings of loneliness, isolation do not interfere with the child's functioning at home or school and social situations. Moderate levels of risk is there are stressors. For example, the child's not involved in groups outside of school. The child occasionally feels lonely or isolated. Child occasionally experiences verbal conflicts at school, and the child reports feeling discriminated against by peers. And stressors interfere across domains of life. And then at the high level of risk, child is getting into frequent physical altercations. Child may be associated with dangerous groups such as gangs or other ecosystems that are often ways that kids try to facilitate belongingness when it is not available in other more adaptive pathways. Children or parents or family are experiencing discrimination from a person in a position of authority, such as a teacher, or the child really has no friends. There are no sort of significant or meaningful peer connections. So if you ask a kid, do you have friends, or is there someone that you would call a friend, or who would you call if you wanted to spend time with, and they are not able to provide an answer. Because again, one friend or two friends goes a really long way. And then these stressors interfere with how kids are doing at home or in school. So put on your pondering hats, your assessment hats. If we can put out the poll for how would you rate this family, low, moderate, or high?
Numbers are streaming in.
And and it's a great question from Amy, if you think it's on the edge between two things, go to the higher level of stress assessment. This one is a little on the edge between, not to give anything away, a little on the edge, but there's one where one fact where it puts it over or puts it into another category.
Okay, we have 63% of folks participating. I'm going to give it one more second. If anyone's on the edge and wants to just click a choice, anonymous guess.
We don't know. We have no way of linking back. This one's a little more tricky than the previous two.
Okay, here we go. Let's see where we're at.
Nice. Well, thanks. Yeah, so folks are right where we're getting a bunch of questions and responses for moderate risk and a bunch for high risk. So we have 69% for moderate risk and 30% for high risk. For this one, how we conceptualize this, we would actually put this in the high risk category because there was a previous question or previous answer that Raju really doesn't have any friends, that he himself and the mom are not reporting a consistent friendship. And again, that's a small thing. Without that, you could imagine how it could be in the moderate risk category. And the reason why it's important to highlight is, again, if you're not quite sure, there's value in going at the higher level of risk, because what it does if you click on the higher level of risk in the toolkit is it will produce, actually it doesn't show it here, but it will produce, because it didn't fit on the slide, it gives you high, moderate, and low levels for intervention strategies for that recommendation. So if you're ever not quite sure, a little bit on the fence, go to the higher one. For high levels of risk, these are really safety related concerns. And again, for Raju in this situation, this is again on the edge. There aren't acute, as far as we're aware, safety related concerns. However, if that is the case, then triaging for safety related services, 911 or emergency room, or depending on what state you're in or in your country that you're in, what are the wraparound behavioral health services available to a family if they have a safety net health insurance, for example, or other private insurance. And so referring to services, and also thinking about how do you make sure that you have a cultural broker or interpreter. Again, in this situation, we're working with Prakash. We want to make sure that we're really working closely with a cultural broker. As Luna is saying in the chat, and these are concerns with kids teasing, we're wondering about bullying as well. Now, bullying, if someone says bullying, it's such a big category. So if you ask someone about bullying, or a teacher says, I think he's being bullied, one thing you want to do is get pretty functionally descriptive, which basically just means asking, what does that look like? Can you give me an example of what bullying looks like? And then within that, you may see, oh, wow, they're really, actually, Raji was actually getting pushed up against the wall and people are grabbing his stuff and throwing it in the trash. And so that's at high levels of risk. Or they're making comments which are really not nice and are trending into high risk, but we're not as worried about acute safety in the we need to intervene today. But again, the verbal challenges can still be incredibly problematic. Then at the moderate level of interventions, these are really strategies focused on facilitating social belongingness. And so this is like the key strategy that you want to be thinking about in isolation stressors is how do I increase felt sense of social belongingness and social connectedness? And so here we have in the second category, connect child and family or children and families to cultural and community supports through schools or mutual assistance associations, things like that. And then also think about in that third bullet, provide information about local activities that provide connection. And I cannot overstate the importance of this category. So there are so many tools that exist within different communities in the United States, for example, that can help facilitate social belongingness. And what you can do as a provider is trying to open the door for those services. So things like connecting to a soccer team or a basketball team, or connecting to a theater group or a chorus or a volunteer group, anything where kids are participating together and hopefully where that has some amount of adult or older mentor sort of accountability for that group. If people have worked with me for any period of time, you've heard me tell the story. One of the cases I worked with when I was doing direct service, I helped connect. I worked with a kid who had a complicated refugee and immigrant background and a complicated trauma history. I ended up connecting with a soccer coach in the community and sort of essentially with permission from the family, connected the kid to the soccer team. And after he got connected, he got a jersey and cleats and shin guards. And after he'd been involved in the group, we had our session. He came into the office, Jeff, with his green jersey, shin guards. Again, he was wearing cleats on a linoleum floor, so I don't know how effective that was with the cleats. I have rarely seen a kid with a bigger smile on the face. If that's an example of belongingness and connectedness, I don't really know what is. The other thing that's amazing about these belongingness interventions is his mom had been really down, had been really depressed. And so she started bringing him to the soccer games. And so that's a behavioral activation intervention where mom is then going with the kid to the soccer games. And in that, one last piece, there's bonding, bridging, and linking. And so what that means is we're connecting bonding to kids of a similar cultural background. So there were kids of a similar background to him on his team. Bridging, there were kids of different cultural backgrounds on the team. And linking, it connected him with people in positions of authority or power. So he built a connection with a soccer coach who in that situation was of a different cultural background. So again, thinking about how do we navigate those levers. Thanks for indulging me in this story. And for the fourth category, we're thinking about traumatic stress. And so if you're from a mental health background, sometimes folks think, oh, I want to do this work, I want to do trauma assessment. And one of the sort of the coaching tips that Luna and I are often providing folks is we actually want to do this, sort of pump the brake a little on this, because we want to assess a lot of other material before we get to this. And this will come in time. And we will get there. Families will be more likely to share information that's helpful as you navigate these other things first. So when we're thinking about assessing trauma, lots of things to be thinking about, including what are the social supports available, what are the environmental stressors that may be present, triggers in the environment, and then what are the kids' ability to regulate big emotion states. And when we're talking about traumatic stress, what we're specifically referring to are stressors that occur when people experience intense event or often events that can cause harm to their sort of ability to cope with that. So extraordinary circumstances, and then how does someone react and respond to that situation? Everyone is affected by trauma differently. And so again, we're often thinking about what are the flight, fight, or freeze responses to survival. In the intervention program that we work on, which is called Trauma Systems Therapy for Refugees, we use a term called survival in the moment states. And that's a way of thinking about flight, fight, or freeze. Survival in the moment states, meaning the point of the response is to survive the moment. And so that is an adaptive, meaning effective response if it is a life or death situation. However, what we're often working on with traumatic stress is folks who are using these life or death responding strategies in situations that they're not necessary, they're not effective. Their emotions are maybe going too big for the situation, and they're lasting too long, and they're in a context that doesn't fit in a way that moves them towards their goals or values. And so it's a mismatch. It's not that the kid is bad or not smart or not resilient. It's just that it's a mismatch. And then how do we continue to understand that and then orient and move those tools effectively? You can think of it as changing a light switch that's an off and on to a dimmer switch. And so part of the work is adjusting to the dimmer switch. So when triggered, as we're saying, there's this survival response, and that becomes unhealthy. And so if you think about a kid or a family that you've worked with who's had significant trauma exposure, often it's this survival in the moment transition where the biggest suffering is occurring. Often your referral question is embedded in that. And so for kids of refugee immigrant backgrounds, we also need to be thinking that these stressors can occur across pre-migration in the context of before resettlement, during the process of leaving, and or in a refugee camp, and then the act of living or being in a resettlement context. And these are just a couple of examples of things that can come up for kids and families. And so we'll move through these now. People experienced hard things during the war and displacement, like loss of loved ones, seeing people get hurt, and getting hurt themselves. Did anything like that happen to you?
Yes, we went through a lot. We saw people die and there was not enough food in the camps. My husband was in jail for a long time and tortured.
What was your life like in Bhutan before the war? What did you do there? Did you have everything you needed?
Before it was peaceful, we farmed, we had a simple life. We did not have much, but we had everything we needed. All of the children were born in the camp.
How long were you in the camp in Nepal? What were the conditions like there?
Conditions in the camp was very difficult, very overcrowded with no electricity. It was dirty. We were there for 16 years. We heard that we were coming to a third country and we waited for over a year.
Is Raju having trouble sleeping, eating, or having nightmares? What are his behaviors at home or school?
He's eating fine, but wakes up at night saying he can't sleep and has bad dreams. Now he's getting into trouble at school and throwing things. He doesn't listen at home.
Are there any ongoing safety concerns, for example, feeling unsafe in your home or your neighborhood, that are causing your family a lot of stress?
My friend was mugged at night, so the neighborhood is not too safe. We just don't go out at night.
And so these are the level of risk for trauma assessment. So low level of risk would be child may experience occasional distress or trauma-related symptoms in response to reminders or stressors. These could be problems with emotion regulation or accessing social support or some other environmental stressors. However, they don't really cause a lot of interference in life and social functioning. Moderate would be child reports some symptoms of emotional distress, such as depressed mood or irritability, and some trauma-related symptoms, such as flashbacks, hypervigilance, or trouble concentrating. And then high would be that the child reports acute or severe symptoms of emotional distress or behavioral dysregulation, including self-harm or self-injury, suicidal ideation or suicide process, and then other types of aggressive behavior where they're getting in significant trouble or significant fights with other people. And so now, thinking about the information that you have, what we know thus far, where might you place Raju in this context?
People are furiously clicking. Heard about 50% of folks have made a choice. Got a couple more responses. Here they come. Okay, great. I'm gonna end the poll and see what we have.
Great, thanks. So for this one, we 61 or 63%, pardon me, is at moderate risk. That's where we view it, and 36 around high risk. And so folks are right on point where, again, this is one similar to the previous one. This one we would put in moderate risk. Often we're doing this one if there isn't significant concern around either violence or self-harm or dangerous substance use. It's often getting placed in moderate, although not necessarily. And the key strategies here for intervention, they're less safety-focused interventions. So again, if a kid was acutely suicidal and we're focused on safety planning or that sort of associated acute work. For here, the focus is really trying to ensure at the moderate level that Raju and or his caregivers are receiving culturally responsive, trauma-informed mental health services. And so this could include, helping Raju build a sense of safety at school and his community, addressing the possible concerns related to bullying, again, trying to understand sort of what that actually looks like, and then again, what you can do as an advocate within the school, and then how you can support Raju in that, and really trying to help Raju build emotion regulation skills. So tools and strategies that he can use to manage his action, affect, and awareness when he may experience a big emotion or experience something that's pretty upsetting to him. So in the context that Luna demonstrated at the beginning of the presentation, throwing a book and running out of the room, that would be something, if you were to use a trauma-informed lens, trying to understand, okay, what was the earliest detectable warning sign in that situation, early revving of that affect, and then how can you build skills around that? And again, this tool won't tell you all those tools, but it will start to put you on a path so you can start building those tools and strategies. And again, we'll talk about some of those ideas in some of the other trainings in this series. And then if you were to go through all of these components as an assessment for Raju, at the end of the online toolkit, it will provide some information. So here it says, you rated Raju at moderate risk for trauma, moderate risk for acculturation, moderate risk for resettlement, and then high risk for isolation, which is what we did. And then you can actually click down here to download a PDF. And so it actually includes all of the information in the toolkit. And so I'm just going to give you one other piece of information, and then I'm actually going to show you, and we'll do a click through together so you actually see the toolkit in use. But again, the thing that's so nice about this toolkit is you can go through this and then you actually can walk away with this information, both the educational material and then how you respond to it. And so before we do the walkthrough of the toolkit, just wanted to sort of highlight where we're going with this toolkit. So we're really grateful for some of our funds from the National Child Traumatic Stress Network for our Category 2 funding, where we have resources we're going to be expanding the toolkit. So embedded in our conversation, we're talking about strengths and resilience. However, in the toolkit, it's not directly centered. And so one thing we're going to be working on is more formally highlighting the strengths that are present within communities and how to leverage those strengths within a community. So core stressors and strengths. We're going to have a version that's available in Spanish as well. Our group does a lot trying to support kids and families from Central American backgrounds, among others. And so we want that toolkit available. And then we're also be providing some training material. So you can think of it almost like a much shortened version of today's presentation that will be embedded in the tool for new users who are trying to orient to what is this and how can it be helpful to me. And so what I'd like to do now, again, this is that blue button diagonally above Luna in my head that you can click on our website. And that's the link there. What I'm going to do is I'm actually going to stop my screen share and we're just going to quickly click through on a web browser so you can see it live. So just give me a moment.
And the link is in the chat now as well, so you guys can follow along with the link.
All right, so this is, imagine I just clicked on the blue button. This comes up. Can folks see the screen? Can you see that okay? Thanks. So this will come up on your computer. If you click on it, scroll down. I'm a TCRC staff person. I would invite you to click yes if it's your first time using it. And then there are these toggle buttons at the bottom. So here's that core stressor visual that you're now very familiar with. Click next page. And then you'll go through and it just provides a lot of the content that Luna and I showed text of and then the screenshots of. So here's the resettlement visual. And then it provides educational content. These are sort of pull-out buttons where it just, if you click on them and you think that may be relevant for your client that you're working with, it provides prompting questions that you may consider. And then here it provides a level of risk that you can be considering. So for Raju, we determined that he was at moderate, so we click moderate, and then it populates the recommended interventions. And again, all of this content will then be available in the downloadable PDF. So for the sake of time, I'll just move through this. Again, you can click on acculturation, language, parenting capacity to learn more. You'd look at the level of risk. For acculturation, we assess Raju and his family at moderate, and then these are the recommended interventions. Now we're at isolation stress. Questions to consider: informal, formal, level of risk. Now this one we determined this was sort of on the edge, and we determined this was high level of risk because of the low friends and the concerns about significant bullying that we needed to learn more about. These are the intervention recommendations. And then here's trauma. Thinking about, this is just to sort of orient related to pre-migration, migration, and resettlement stress, these three categories. And then questions to be considered related to emotion regulation, social support, and then other processes in the environment. And then for Raju, we assessed that he was at moderate risk. And then here are the recommendations. And so then these are some questions that we added in. So this is that where this is where you place the assessment, moderate for 3 of them, and then high risk for isolation. It asks you, we now have this tool, it asks you, how did you use it to assess the needs of a specific individual client? In this situation, that's the button you would click. Again, this is just helpful information for us as we continue to develop the tool. If you have any feedback for us, we appreciate it. We do read it. And then you can click submit. And then it comes here, and then you can download this PDF, and it will populate this PDF right here. Let's see if it will open. And it will pull up the PDF that just shows all the same text, just in a downloadable format. And I'll stop that, and then I'll go back to our slides. If you're thinking about what kind of measures could you be thinking about if you were building a quantitative tool in your program or in your practice for thinking about what are the best ways to assess these 4 core stressors, there's a number of effective tools in different languages. And so this is a resource on NCTSN that we helped contribute to that provides lots of recommendations for evidence-based culture responsive assessment tools. And then these are some other helpful resources. Again, these will be provided to you in the materials for content related to psychosocial assessment and triage. And thank you so much for your time and attention. There are a few things more valuable than your time, and we're very grateful that you spent it with us today. So thank you.
Wow, holy moly. Thank you so much, Jeff and Luna, for giving us so much content, along with so much practical information, this tool that I think in the chat sort of blowing up saying, thank you, this is such a great tool, what great information. You probably can't see that because you're so focused on presenting. I had a couple questions that came up in the chat that I'm hoping we can have some time to think through. One is a very specific question about Raju and thinking about how we put Raju into the moderate level of risk category. there was a question about sort of how do we understand Raju's aggressive behavior at school? How does that get integrated into his, like the location? There were some questions about like, should he be maybe high risk? How do we think about aggression if we're putting him into moderate risk? I'm wondering if you can speak a little to that, Luna or Jeff. Yes, and everyone will get the slides, the recording, all of the resources that we shared. So don't worry about that. It's coming your way. But yeah, I'm wondering if Luna or Jeff, you could speak to that specific question.
Yeah, no, that's a great question and an excellent point. I think if mom had specifically said like he's getting into fights and or he's there's concerns around suicidal ideation, of course 100% if there's any concerns around safety he would be at high risk. But just based on this particular assessment with just mom, she didn't say anything in terms of aggressive behaviors that he had towards other children or any self-harm behaviors. So just based on that, we would not put him at high risk yet. I think he could very easily slip there if we learn a little bit more about the bullying, if we learned a little bit more about, okay, I think teachers did say something about aggressive behavior, but aggressive could be in so many things. We just want to, this is a very basic first assessment. There's still a lot more that we don't know. So we'd want to gather more information at this point. So at this point, I think we would say moderate based on what mom has said. Jeff, I don't know if you have anything else you want to add.
One other thing that just to add is this tool, and then basically all the tools that we work in our program are really phase-based, meaning where someone is in a phase of an intervention, that can change pretty dynamically week to week. So you could do this assessment and then something happens that a level of risk changes significantly. For example, someone who was out of the home, who was physically aggressive, is now back in the home, and that would increase risk of one of the phenomenon. Or a thing can decrease. Oh, that person is now no longer in the home, and so one of the major stressors in the environment has been removed. And so it's something that you also want to be continuing to return to and be oriented to as major changes in the environment evolve.
Yeah, and once the family is receiving treatment and mental health services, we would do a whole comprehensive assessment that goes much deeper into the behaviors and the incidents and the history, the developmental history. There's so much that we don't know. So, but for this first kind of triage needs assessment, that's where we would place him. And then once we start meeting with him, we might need to increase and do home-based or school-based interventions based on the level of need and the level of risk.
One other pretty practical thing I just wanted to make sure to highlight is folks are not often using this. Like, people are not often like having their iPad with, if it was with you, if it was me and the cultural broker and Raju or Raju's mom, I wouldn't be like doing an iPad of the tool with them directly. The way folks, there's lots of, I mean, telehealth is different in that you actually could have it up on a screen as you're engaging it. The way that people use it more is using it on the back end and coming in with the questions that they want to ask, or being prepared. You know, they take this and they integrate it with say the 2 measures that their service delivery agency requires that they give in order to bill for a particular insurance. And so combining them together. So don't feel like you have to be stuck clicking the button with a kid in front of you. It's more, how do you orient to it, or how to use it, you know, in preparation for a session. So that way, again, you're able to sort of distill some of this information.
Great, thank you both. Another question I got is, you know, this series, I think most of people who have logged on today are involved in mental health professionals. Jeff and Luna are clinical psychologists. Do you need to be a clinician to use this this toolkit, to walk through this toolkit, to use this with, or sort of use these questions with families?
I think the main answer would be no. And part of our, you know, our group tries to be pretty public health oriented, in that we really want to scale, we want to give everything away, basically, so that way people can use these in different settings. So there could be lots of different contexts. We have a lot of educational partners, folks who work in schools or school administrators, for example. If folks are, for example, public safety professionals, like juvenile focused police officers or things like that, thinking about kids that you interface with, core content. The content is relevant regardless of your professional background. It's then how do you choose to utilize the information in the context of your particular sort of professional area.
Great. I'm not seeing any other questions come in the chat. I'm sure if others come up, you know, Jeff and Luna, your email address is up there. I think I want to again thank our presenters. I want to thank Jeff and Luna. I want to thank all of you. We had over 125 people show up today, which is so incredible. I think just speaks to how folks across the US are really working to care for immigrant and refugee youth, which is just so impactful for us at the center to see. I am going to say again that if everyone will receive a recording of the talk, it will be added to our YouTube channel. You'll receive slides, all the resources that Jeff and Luna pointed to. You'll also receive links for those too. You will also be receiving an email asking you to register for our next best practice series training, which will be on May 23rd at 12 Eastern, secondary traumatic stress. You may or may not see my face there, so that hopefully that's either a positive or negative to throw out there, but we're really excited to bring this topic as well to the front. I know, right? We're also excited. If you have any questions, can you click to the next slide, Jeff? That is my contact information there. Again, I'm Amy, I'm the program coordinator. Please, any questions, feel free to send my way. My contact will also be in follow-up emails. Thank you again all so much. I'll gift you the next 10 minutes for you all to maybe do some self-care, take a stretch, get ready to transition to the next thing that's coming up. I know we have all busy days. So with that, thank you all so much. Enjoy the rest of your day, and hopefully we'll see you May 23rd. Thank you all.
Thank you all.
Thanks, everybody.